In the last module, we saw that poverty is highly correlated with a number of undesirable outcomes, including poor health, low future earnings, and limited educational achievement. We also learned that there are several types of explanations for these correlations. Those include the possibility that poverty causes these outcomes, the possibility that the outcomes actually cause poverty, and the possibility that some other factor is driving both poverty and the apparently related conditions. The question of why poverty is correlated with so many negative outcomes is a critical one. If this relationship is causal, then alleviating poverty, providing poor families with higher incomes, should also reduce many of the associated negative effects. If, on the other hand, the relationship is not causal, while we still may want to provide poor families with assistance, we should not anticipate that this assistance will improve later outcomes. Distinguishing between these two cases has occupied many social scientists for many decades, and in the past 10 to 15 years there have been important changes in our conclusions about this question. For many years, much of the best evidence on the question of whether poverty caused negative long-term consequences pointed in one direction. This evidence was summarized in a popular book by sociologist Susan Meyer. The book both cited many studies and included new research, much of which suggested that providing more money to the poor would do little to break the cycle of low education, poor health, and continuing low income. It's worth understanding how Meyer and others reached these early conclusions, many of which were based on studies from the 1980s and 1990s. First, there were many studies that used differences across states in the level of welfare benefits and checked to see whether those living in states with more generous welfare systems were less likely to suffer the negative effects of poverty. This approach yielded very little evidence supporting the idea that more generous welfare benefits would lead to improved outcomes. There are at least two major limitations of these studies, but they point in different directions. One concern is that the AFDC program, on which most of these studies were based, provided income supplements for relatively brief time periods for most recipients. It could be that more generous benefits had little effect because they didn't lead to very substantial increases in family income over a substantial period of time. A second concern with this approach was that benefit levels for AFDC are not set in isolation. States with more generous AFDC programs may also have invested more in other social services for the poor and other parts of the safety net. Not controlling for these omitted factors could make it appear that more generous AFDC benefits have an effect, even if it is really the other benefits that matter. Of course, this should have made such studies more likely to find effects, and as noted, they rarely found the expected effects at all. A second type of study used variation in the timing of when income was received by families and in the outcomes of interest. Here, the aim was simply to show that there were other explanations for the correlation besides the intended causal explanation. For example, in a study of teen births, researchers looked at the effects of family income both before and after the teen birth. What they found is that income received by teens' families after the teenage years sometimes had a larger effect on predicting the likelihood of a birth than income received prior to the teen years. This makes it very difficult to argue that the observed correlation between poverty and teenage births is causal. Finally, a third type of study attempted to look at detailed data on specific resources purchased by families with higher incomes that might directly relate to educational or other outcomes. In particular, it asked whether investments in higher quality or private schools, tutors, or other educational enhancements seemed to improve educational outcomes. This was meant to test a very specific and direct potential mechanism that family income and the resources it can purchase improve educational outcomes. These studies produced little convincing evidence of such a direct causal connection. This conclusion that poverty was unlikely to cause many negative outcomes, and the corresponding conclusion that providing money to the poor was unlikely to improve their long-run circumstances, was certainly not universal, but was widely held by many economists and sociologists over many years. In the past decade or two, however, this view has begun to change. This has been based on new evidence, based on new data sources and statistical methods, and suggests an opposite conclusion. There are at least three types of studies that have contributed to this turnaround on this important question. First, several studies have used what are known as quasi-experiments, situations that result in resources being provided to or taken away from groups of individuals fairly randomly, and opportunities to study the resulting outcomes. For example, some researchers have studied casino openings on land controlled by Native American groups. Often, these arrangements result in the profits from casinos being distributed to all members of the Native American tribe in the associated area. This means there is a sudden and lasting increase in income for some. Often, comparison groups in other geographic areas or from those who are somehow not eligible for the payments are incorporated as well. Here, researchers have found evidence of improved outcomes among the poor children who receive these income supplements. Similar quasi-experiments have been done based on the outcomes of lottery winners or those receiving benefits from oil or fracking rights in their own geographic areas. Two other types of studies have also provided related evidence, those examining effects of job loss, or firm closings on kids and adults, and those that use variation in public policies to induce variation in resources. A number of studies have looked at the effects of job loss on families to understand the role played by income in shaping future outcomes. The reasoning here is that job loss of a particular type, job loss that comes about because an entire company closes or because a large firm lays off many workers because of reduced demand for their product, can provide a sudden change in income that is not the result of the affected workers' actions or underlying traits or abilities. We also know that such job loss is associated with large and long-term reductions in individual earnings levels. Thus, following individuals and families before and after such job losses can give a glimpse into the likely effects of changes in income levels. One such study with dramatic results is by Sullivan and von Wachter, who look at a sample of individuals losing jobs during mass layoffs in the 1980s. They're able to compare these laid-off workers with those who remained employed at the same firms. Importantly, they present evidence that the choice of who to lay off was not based on individual traits, but rather on seniority and other predetermined characteristics, with large portions of each firm being laid off. These authors then followed these workers for up to 20 years and found an increase in mortality rates of up to 20% among the group that had been laid off. This suggests that the loss of income itself seems to have had very negative effects on health. A similar study from my own research, conducted with two colleagues, took a similar approach but looked across generations. In this study, we again looked at a sample of fathers who lost jobs when their companies laid off at least 30% of all workers. We wanted to look at whether the income changes associated with these layoffs affected the children of these parents when they became adults and entered the labor market. This figure shows the underlying quasi-experiment. We divided the sample of fathers into those who remained with the same firm from 1978 through 1982, and another group whose firm closed in 1982. The figure shows the income paths for the two groups, with the important feature that, prior to 1982, the two groups had identical income levels. Those who lost their jobs suffered a reduction in income of approximately 12%. Next, we compared the adult children of these workers, observed 10 to 15 years later. We found that the adult children of those losing jobs in the 1980s had earnings themselves that were roughly 9% below the control group, whose fathers hadn't lost a job. While this does not speak precisely to the typical experience of poverty, the fact that a dramatic lowering of income does seem to cause harm that carries forward to the next generation works to establish that some of this relationship we observe may be causal. Finally, in recent years there has emerged a new generation of studies that also use public policy-induced variation in income and resources, but that goes beyond the older studies of AFDC. We learned earlier about a study of the initial years of the food stamp program that looked at how providing food stamps affected labor supply. The same team of researchers also looked at how the introduction of the food stamp program affected the health of program participants. They found, when looking at adults who had been exposed to the initial years of the food stamp program, that they were in better health, reduced obesity, reduced hypertension, and lower rates of diabetes as adults. This was attributed to the improved nutrition and reduced stress associated with the additional resources provided. Several recent studies have also used expansions in the EITC and asked whether these have been associated with improved health or other outcomes among poor recipients. Two such studies have found that more generous EITC refunds seem to reduce the incidence of low birth weight and increase test scores among poor students. An important question is why these program-based studies support the idea of a causal link between income and health, when the earlier generation, based on AFDC, did not. It is possible that the EITC provides a more lasting and stable income supplement than did AFDC. It is also possible that improvements in data availability and statistical methods have allowed us to better isolate those effects in recent decades. Overall, there is a growing body of evidence that additional income paid to poor individuals and their families can reduce the negative consequences of poverty. Similarly, studies of job loss provide stronger evidence that negative economic events may actually cause harm. Together, this latest set of research provides more direct validation than we have had in the past that provision of safety net programs and assistance for the poor may well have long-term benefits. In the final module, we'll ask what mechanisms might explain the causal connection between poverty and long-term health, educational, or other outcomes.